Welcome to Clinicbe's video, and we're going to be talking about the PRP Endoret Serum and the home use for it. In this video I'm going to talk about what you can expect on your appointment, talk about the transportation process of the serum as well, and how to use the product. I will also be talking about contraindications to the treatment, as well as talking about patients with skin conditions that will benefit from the treatment. On the day of your appointment, during the consultation process, we will have a chat with you to find out what your concerns are, what it is that you're willing to achieve from the treatment, and what we can obtain. We will also touch on any questions, queries that you may have regarding the treatment, have a run through the process, and establish whether you are a suitable client for the Endoret Serum. After the consultation is complete, we will begin the process by taking your blood. After that, we would usually ask you to come back later that day or come back the following day to collect the serum, as it does take 2 hours to prepare, just so you're not waiting around. So on the day of your collection, you will receive a package for your serum, and I'll just run through with you what is in the package. So upon collection, you will receive a package similar to this, so you can take this away with you. I'll just run through what is in the package. You will receive a tin containing your Endoret serums. There should be around 10 vials, each containing just over 2 ml of the serum, so it will look like this inside. You will also receive 2 ice blocks, a cool bag like this, and a dermastamp. It is extremely crucial for you to place the product immediately into the fridge once you get home. The product will not last unless you do so, and please remember not to put it in the freezer because this product is not suitable for freezing. So now let's talk about how to use the serum. So in order to use the serum effectively, we would require you to cleanse your skin thoroughly, so that would include a double cleanse, and if you do have a toner in your skincare regime, then to apply the toner at this point as well. After this, we would ask you to take just a few drops of the serum and apply it to your fingertips, and then spread it onto the area that you're treating, whether that's the full face or specific areas which will be discussed in your consultation. You only need a few drops, as the product is very potent, so the serum spreads very well. And once the serum has sunk in well into your skin, we usually say wait a minute or so. You can apply a soft moisturizer, very gentle, natural ingredients. If you have a moisturizer that does have active ingredients, it is worth to mention during the consultation process so you can be advised accordingly, as we don't want to undo any of the benefits from the serum. But again, if you are unsure about anything, then you can give us a call or send us an email to double check anything, and we'll be happy to guide you there. We usually advise to use the serum approximately 5 to 7 times per week. In the evening works better, but again, this is something that can be discussed in greater detail during the consultation period. And typically, the product should last you around 2 to 3 months, depending on the area that you're applying the Endoret serum to. Okay, so this part of the clip we're going to discuss about how to use the serum with the dermastamp at home, providing it's more like a skin treatment. So again, double cleanse so you can have a thoroughly clean skin, and then add toner at this point to your skincare regime if you already have one. Next, just the same as before, apply a few drops of the Endoret serum to your fingertips, and then spread that evenly across the area, so whether that's the full face or if it's targeted areas. Again, this would have been discussed during the consultation period. Next, you take your dermastamp, and then you make sure that the tip is perpendicular to your skin, and then you just press into the skin, making sure that you cover all of the area. If around the eyes is an area that you are concerned about, or that's the area you are treating and have discussed with Dr. Kubicka, then I would advise to stretch the skin under your eye and then press the dermastamp around, and be careful not to treat beyond the bone. So make the bone the limit. So stretching will enable more coverage of the area. In terms of the frequency of the dermastamp, we would advise to use about twice a week out of the 5 to 7 days that we recommend the use of the serum. Again, all of these will be outlined in your consultation, and you can give us a call, or if you wanted to double check any of the information, anything you're unsure about of the process, and we will be happy to guide you through. Another benefit of the serum is actually to promote some hair growth, to stimulate the hair. So you can incorporate this with your hair treatments as well. So when it comes to using this, for the preparation, we would recommend to have freshly washed hair and dried hair. Again, so we would ask you to apply some of the serum into your fingertips, massage into the area, into the scalp, and then repeat with the dermastamp. So just make sure that the tip is perpendicular to your scalp, and then press till you're having a systematic method. Make sure you're covering all the area, and then once you are done, you can rub in another layer of the serum. So typically you can expect to use a complete vial per session, and we usually recommend to use this method once a week. So now I'm just going to discuss about how long the serum will last. Typically it's said to last about 3 months, but it could vary between 2 to 3 months depending on the area of treatment and the frequency required of the treatment as well, which are all going to be highlighted during your consultation process. So this really is a great time to establish a baseline for the program of the Endoret Serum. It's good to use this so you can follow a regime with this as well, so it just is easier for you to follow. So the next point I'm going to touch on is how to look after your dermastamp in between treatments and how to sterilize it. So when first using your dermastamp, so when you remove the dermastamp out of the box, it will be sealed in a blue sterile packaging. So the first time you can just use it directly, making sure that you take off the white cap off the top. After that use, it is best to sterilize it straight away. It's just more hygienic and it's just easier to clean. You can do this by pouring over boiling hot water over the tip. So you can do this for a couple of minutes so the boiling water can run through and just clean this for you. And then you can repeat this once again for your next session with the dermastamp. Another tip actually that I've learnt when using the dermastamp, if this is your second session or after your second session, is probably best, it's more time efficient if you were to sterilize your dermastamp beforehand, before cleansing. So then when you lie the dermastamp onto the paper towel to dry naturally, it will, while you're doing your cleansing routine, that will be ready for you, so then you can just crack on straight with the serum and the dermastamp as well, and then again just cleansing and sterilizing after you are finished. So now I'm going to discuss about suitable candidates for the Endoret Serum. Generally it's very good for skin rejuvenation, just to help for healthier skin. It's also good for people suffering with pigmentation because it's a very gentle approach to help treat that as well, and it works very well with the dermastamp, which enhances the benefits. It also works very well for scarring, acne scarring. It works really good for hair stimulation, so like on the scalp. So we can use that or incorporate that if you have any hair treatments for any hair thinning, hair loss. It's also very good for patients suffering with rosacea and acne prone skins. the serum itself is quite beneficial for skins suffering with such conditions. So, contraindications to the Endoret serum. Again, contraindications is something that will be discussed in detail during your consultation. Most of the contraindications are from the stamp itself. So patients suffering with active acne or active rosacea would be contraindicated to the use of the dermastamp, as this is a risk of making this worse. However, saying so, the actual Endoret serum itself would be very beneficial to use alone, as it contains, because it's your own plasma, so it's very good for healing, so that would help. When it comes to the actual serum, there are things that can factor into contraindications for this too. So it's usually certain medications or some systemic diseases that someone may be suffering from. For example, cancer could be one. Unfortunately, wouldn't be a suitable client for that, as it involves taking blood. So it's not something that would be recommended. But again, this is something that can be discussed upon consultation, as there could possibly be ways around it, but again, it's best to find all your information there. Thank you for watching. I hope this video was very useful. If you do have any more questions, any concerns, any queries, then do just drop us a call, or you can even send us an email, and we will add in our contact information below. Thank you.